this is Joy with New Motion, your assistive technology professional, and hopefully I can help you with all the technology needs for your patients. Today I want to briefly discuss power options. So when you talk to your patients, whether you're a physician or a therapist, if in your notes that you write a recommendation for some type of power device, I want you to know all of the options that kind of exist. Some of these are more custom than others. So first of all, we have these two options, kind of a basic group 2 power wheelchair or a scooter. Okay, so these are kind of the lower end of custom. The scooter, we really cannot customize the seat or anything else. The power wheelchair, we can customize the seat depth, the seat width, some of the support features, as well as kind of the height of the chair. So there are some things we can customize there. Then we can move on, and these are actually custom manual wheelchairs that have a power option added to them. A lot of insurances or payers do require the patient be in a custom manual wheelchair for a year before adding the power option, but it can be very helpful. So here we have the Twy-On, and basically what happens with the Twy-On is it adds push to the chair. So if someone has limited strength in their arms, when they push, it can extend that push, giving them a little more mobility. And then here we have the Smart Drive, which is kind of a power pack that you can take on or off of the chair when you want to use it. And it's actually controlled by a wrist device or buttons on the chair. So someone can actually use it hands-free, and it will actually propel the chair. And then just by putting pressure on the rims, they can steer with it. So really helpful, especially for really active users, people that do a lot of activity. Maybe they are self-drivers as well and need something that they can kind of pull across themselves getting in and out of cars. This is a great option. Again, it is only on a custom manual wheelchair, so it's important they have that beforehand. These we can customize everything: seat depth, width, support features, types of back, types of cushions, types of rims. We can really look at what the person's functional needs are. And then we move into the group 3 power wheelchairs. So these are all very customizable. It's difficult to show one of these to a patient because theirs might look very different. So here you see that we have a lot of thoracic supports and arm trough support, padding to prevent wounds, things like that. And you can see the size is very different. This one doesn't have laterals, but has a really deep contour. And this is actually an air cushion in the back to prevent wounds, right? As well as it has a lot of positioning in the cushion. Okay, and then here you can see that these also have dynamic features to help someone who is more of a static sitter, someone who needs that dynamic ability to support them being dynamic and preventing wounds, helping them with sitting tolerance, maybe assisting even with catheterization, reducing spasticity. So these are all things that we look at when developing a chair for someone. So this is what a power wheelchair could mean. Any of these options are power wheelchairs. Okay, now a scooter, if you write a scooter, it's only for a scooter. Okay, if you write manual wheelchair, we're looking at the manual wheelchair without these power options. So just something to keep in mind, and note that during the evaluation, we will assess how they are controlling all of these. These can be done with any control, head control, foot control, anywhere where the person has some repetitive mobility where they can dictate what position or driving the chair, things like that. So let me know if you have any questions. Happy to talk to you about these products or anything else. Thanks.